Because as a dentist, what people think is like, say, like show your teeth and that's it. No, we treat you as a whole. So we come in very close contact with a lot of diseases, especially when you are very close working with a oral cavity. Because I myself had like I've been like TB ho gaya tha mere ko, and then I am recovered. Even though many people will tell you कि like dentist doctor होते हैं क्या, this is, I'd say oral health is neglected in India. We need a lot of dentists in India as of now. Let's say US, UK, Australia, anywhere. The amount of respect, first of all, I'll be very blunt with it. The amount of respect that you get outside is very high, and the amount like money, monetary wise, they earn a lot. Number of government jobs are very negligible. It's not even 1%. As compared to a MBBS. You are not taught in college what people practice outside. We are advanced. We are way advanced than what you are taught in college. The COVID situation, it was horrible for dentists because we were defined as a non-essential thing, a legal part. That is, once you are out, you are liable to sue. Average fee for a post graduation will be somewhere between 4 lakhs to 7 lakh, and I didn't want to get in debt. The last decade has changed a lot. So I've been practicing since 1 decade now. Wo decade mein na, the patient's perception has changed a lot. Now it's like this, like quick. I need it now. I need it now. I need it now. To get that time, and then the dentist, what they are doing is they are submitting. Submitting towards it, but that should not happen, but that is happening in real world. I pursued with dental photography. Now that is my USP. Now what is your USP? You'll have to define it. So if you don't have a USP, why the patient should come to you? As a whole, dentistry looks like this much, but seriously, we don't know anything about finance. We don't know anything about business. So that is the advice I will give you. Go and learn about business, and go and learn about finances. I know a lot of dentists who have left dentistry and doing something else. So they are doing MNC jobs, and they are doing, they're pursuing their hobby, like dancing kar rahe, and people are teaching dancing. People are doing, what do you call that, wedding planners and all. There is an upcoming field known as laser dentistry, which now that is going to pick up.
So being from a tech background, I can say for sure, like technology, the trends keep changing so fast. We have to be up to date with what's happening, and it's also penetrating dental industry now, right? Like all this photography, laser.
Their minds are like blown away. अरे हम लोग तो ये हाथ से कर रहे हैं. Now there's a machine to it. It saves a lot of time. One thing is you should have a network. That's the biggest hindrance. And the second thing is monitoring. If you pass out and you want to straight away put up your clinic, don't do it. Even a BDS person, I have seen like earn lakhs and lakhs of rupees in a rural area. If you're going outside, make sure you're practicing there rather than coming back. Number one profession in US is like earning wise is dentistry.
Okay.
So, but to put in that much, they'll have to, they are in debt of millions of dollars already. If you know your things properly, you can diagnose a patient of a diabetes and a blood pressure just by looking at the oral cavity. Because I didn't get an MBBS, I have taken a BDS thing. It's not the same. So once the dental insurance lands, everyone will be benefited, even the patients and the doctors both.
Hello everyone, today we have with us Dr. Avinash Narayankar. We met as a part of a video editing course that we were taking together, and I got to know that he's like very interested in helping others in teaching the learnings that he has had. He has had a very great career in dental field, and he's been the HOD at the age of 33 already. And I thought like he has got some good learnings and experience that he can share with people aspiring to be doing good in dental career, and also bust some myths or misconceptions that people may be having. I've collected a few questions that people usually ask Avinash himself from my friends. So yeah, today we'll be covering all that. Hi Avinash.
Hi, hello everyone. So I am Dr. Avinash Narayankar. I am from basically from suburbs Mumbai, Maharashtra. I am a dentist. I did my dentistry in 2012. Then I pursued my further education in specialty. Like there's a special fellowship which goes on in oral implantology and laser dentistry. So I did it at 2017. So I was a gold medalist in that. Then going back a little bit, so I am just jumping up a little bit. So the thing in 2015, I did one course on dental photography, And for last 5 years, I've been teaching dental photography as like a primary thing in my dentistry. So that's my giving back. And I am, as you have already mentioned, I am an HOD in MGM Institute of Health Sciences, Navi Mumbai.
Can start with more on the career path.
So career path for a dentist, if I say, um, it has both sides. See, every career has both sides. There's a good side and a bad side. So even dentistry has a good side. Good side is like we are like one on one with the patient. We don't like just prescribe a medicine and then say ki ha baba ye le lo, and then you go ahead, and we actually have to treat a patient as a whole. Because as a dentist, what people think is like say like show your teeth and that's it. No, we treat you as a whole, because the holistic treatment plays an important role in dentistry. Now the other side is like there are a lot many things which are associated, for example in medical part. So we come in very close contact with a lot of diseases, and especially when you are very close working with a oral cavity where you have a lot of bacteria and everything, and we ingest like inhale the things and everything. Even though we have a mask, we are very much in close contact
Precautions.
with the patient. The precautions are there, but see, a dental student, if I'm like seeing from a dental student's perspective, he doesn't have that much of knowledge, because we start the patient at third year. Like, so we have a 4 year course plus 1 year of internship. So he starts at the person, he or she will start the patient at third year. Third year, maybe we don't have that much knowledge and that much thinking how I can get that disease, I can then get this disease, I should be taking, because at that age we are not careful enough. So that's the other side, because I myself had like I've been like TB ho gaya tha mere ko, and then I am a
Oh.
recovered. So at that time we didn't have that much of thing. Then I later find out it is because of close proximity of the patient. This is what I have contracted with the through the patient. So now these are the things which are the bad side of a dentistry. But good sides, of course, there are a lot many good sides, because like even though many of people will tell you कि like dentist doctor होते हैं क्या this is the question, of course we'll get to it later, but it's a specialized part of a medical system. So we are not just here कि medicine जैसा गोली दे दो, as I said कि गोली दे दो खत्म कर दो. It's not like that. We are very specialized. We only treat with a certain area. So if we go in the MBBS side, उनको MBBS करना है, then they will do MD, and then they will do super specialization to go in a very particular special part of a body. Let's say ENT. So या फिर optometry. So उनको आता है at the MD level, that is postgraduate level. But in our field, we are already specialized in a particular in a particular area itself. That is our oral cavity. And later we go again. So now, if I have to define postgraduate in our field, I'll define it as a super specialty, because it is further going inside to a particular part of it. Let's say for the gums. So gums. So periodontologist, like. So that perio people, they only treat with the gums. Now ortho, that braces, they only treat just for that straightening out. So that is a super specialty. So that's the beauty of dentistry, that you work with very close, and you change people's lives. So whoever, like anyone can argue with me, and I'll argue with me, because we change people's life. So
Right.
that is the baseline of it. Because once you change the smile of any patient, any teenager for that matter, or a
Right.
little bacha, the confidence that they get is like, I cannot put it in words, because
Right.
their life changes. So you're changing somebody's life.
Yeah, and I'm sure like most of the people in the childhood would have gone through the agony of handling with the teeth, the orientation clips, and all that decays cavities, maybe some of them. So I'm sure like it makes a big difference if you can you cannot live with it. It's impossible to live with it. It
Yeah.
has to be taken care. So
Yeah.
yeah, I think definitely there's a huge impact that you guys are creating. So specific to India, what does it mean to be a dentist in India compared to other places?
Okay, compared to other places, of course, in India, then dental surgeon as such is it's neglected. Like if I'd say oral health is neglected in India, we need a lot of dentists in India as of now. So if you see that parity that between the number of patients and the number of the doctors, it's very like less as compared to outside. We need a lot of them. But uh, if we consider outside India, let's say US, UK, Australia, anywhere, the amount of respect, first of all, I'll be very blunt with it. The amount of respect that you get outside is very high, and the amount like money, monetary wise, they earn a lot more as compared to a dentist in India. Of course, that's there. That's the true fact. But uh, it's like if you have to go outside India, our degree is not valid to a lot of countries. Like a developed country, it's not valid. Then you'll have to go and do a DDS degree, and then go and you can start earning in it. Like actually doing patients, you're not allowed to do patients, by the way, if you go with a BDS degree and out of India. The demand for an dentist in India is high, but there's a differentiation. There's a difference because the government is not doing much for it, because number of government jobs are very very negligible. It's not even 1% as compared to a MBBS or a medical side field. So there are less number of doctors in government hospitals. So like either you have to be on your own, or you'll have to do a postgraduate, or you'll have to go outside. So these are the options that you get now. Because we don't have a lot of job opportunities, people are doing like there's something known as kind of an internship, but not an internship. Like once you pass an intern, and then you go and then you join some dentist, and they himself will not treat you properly. So you'll not
Okay.
earn a lot once you are out of the dental college. And that is one of the reasons why dental fraternity doesn't get a lot of respect, because young dentists don't get a lot of respect. But that is also true in a sense that you are not taught in college what people practice outside of college. Like in market, we are advanced. We are way advanced than what you are taught in college. So once you are out of college, you'll have to teach either yourself, or you'll have to join some other courses and get to that level to perform to that level. So get to that level, like a normal, for example. So now nobody does something known as amalgam. So that silver filling that people used to do a decade back. Now nobody does it. What people do is composites. So composites are basically a tooth color thing. Of course, both have advantage and disadvantage. I'm not saying that silver is an inferior material. It is way better material in some circumstances. But people don't do it, and we are not taught composites in even in
Okay.
fourth year. It's just a small fraction of your syllabus. And then you are out, and when everybody is doing that particular treatment and you don't know how to do it, and especially in front teeth, where aesthetics is much more important, because nowadays the youngsters have a lot of that value. So like, I need to look good, and
Consciousness, yeah.
consciousness. So if you don't deliver it, the patient will not come back to you. So that is what I mean by to getting to that level. So if you want to get to that level, you'll have to train yourself by joining courses, and you'll have to shell out money, even if you have a proper degree, BDS degree of practicing, but you are not trained to it. You don't have a practice. That is the reason it is known as practice. You'll have to practice. There's no workaround to it. कि हाँ बाबा मैंने एक YouTube video देख लिया and then हो जाएगा. It's not like that.
Right. So like again, I can relate even in software engineer or computer science engineers, right? Like there is hardly any government jobs. They also have to look for private jobs, and there is a gap still in the industry and what they are taught in the college. So I think that's also common. And regarding internships, right? Like we also see that same issue, right? Like what we actually do hands on, we miss out on that in the college. So we usually go for internships by ourselves after our first year, second year vacations sometime, or even during courses are going on. So is that possible in dental? Like maybe it is not going to be virtual, definitely.
Virtual is out of question, first of all.
Yeah,
So you'll
right.
have to be there. Now, the COVID situation, it was horrible for dentists because we were defined as a non-essential thing, and we were supposed to shut down. Now we were shut down for like 3-4 months, and imagine like 80% of us are on rental space. So I myself was on rental space, so I had to shell out a lot of money just but close down, and I had to feed not only myself but my assistants and my like cleaning staff and everyone. So I have to take care of that also. So monetary wise, going out of intern, like if I have to say that let's put that aside. We'll come back to that part later. But doing an internship outside is not possible because people will not take you easily. Okay, so let's say I have a clinic and somebody comes to me and say, "Okay, I want to learn from you." Now people will expect something. So like learning and doing a job is completely different. If somebody comes to me and say, "Okay, I want to learn from you," of course I'll welcome them. I'll teach them, and like you go away with your path where you're going. But now when a junior comes to me and say, "Can I want to work with you?" Okay, if he wants to work with me, I have to first of all teach him my way. There's a certain way anyone works. Okay, for example, in coding also, there's a type of coding. Everyone has a signature. So every
Right.
dentist has a signature. Unka like way of working is different. So now first of
Right.
all I have to teach. Yeah. So now first of all I have to teach him how what
Hmm.
my way of work is, and second of all I have to teach him and get to my level.
Hmm.
And
Hmm.
the third thing is he'll expect some kind of pay.
Hmm.
Okay. Now that pay is very nominal. People give
Hmm.
very nominal fees. Sometimes I started with zero, by the way,
Hmm.
then with
Okay.
3,000. So then to
Huh.
3,000. That was he was giving me out of like pity, like हाँ ये तेरा
Ah.
pocket money करके ले ले. But I was there to learn, so that was a different
Ah.
part. I was there to learn. At least he was
Right.
paying me something. But if you people what expect now is at least or 20,000 salary, 30,000 salary, which a normal dentist will not afford to give you because that is the
Hmm.
profit margin he's working with.
Hmm.
So if he gives you, I'm talking about an average. Yeah, I'm
Hmm.
not talking about the extreme. So every industry has an extreme. Somebody will
Hmm.
be earning a
Yeah.
lot of dough with little work, and somebody will be
Hmm.
doing a lot of work and earning a little bit.
Yeah,
So
like
now,
outliers usually we have like they will be there that will be
yeah,
excluded. Yeah.
yeah. So if I'm talking about majority, what are they are earning somewhere between 30,000 to 70,000 ke beech mein. So
Hmm.
if he shells out 20-30,000 for you, so what remains to him?
Hmm.
So
Right.
now, people are not accepting any internship program as of now. So you
Hmm.
have to learn on your own.
Hmm.
And there's a second part, there's no, a legal part. That is,
Hmm.
once you are out, you are liable to sue. ठीक है,
Hmm.
liability बन जाता है आपका. Any patient comes to you, you are the liable person if
Hmm.
anything happens to him. But if you're in
Hmm.
college, that is not the question.
Hmm.
Okay, now people are very aware about this legal part, and colleges are also teaching ki, like
Hmm.
you should know about this. Like this is what a medical legal issue is, and so if the person is liable to me, I should be more cautious. And people are very cautious now. People are so
Hmm.
that is the reason. That is one of the reason also ki, that we are not accepting the internship because something happens to the
Hmm.
patient. I am liable,
Yeah.
not the person because my name is
Right.
on the board, not his.
Correct. Right. Right. Yeah. Yeah, I see like, that legal aspect will be a real problem because in software engineer, like we can undo anything if there is any most of the times. And also like we also follow the same principle, like learning is more valuable than earning in the initial career. So in future, it will compound return. We can discuss more in detail about maybe some aspects in your career journey where you had some ups and downs and major important lessons or learnings that you had, which you can share.
Yeah. So when I started with like I didn't have an idea whether to go for my post graduation or whether to pursue with my career like as a like normal BDS dentist. Utna hai.
Hmm.
So I was confused, and then I opted. No, I'll not do a PG postgraduate because I'll pursue with what this thing because doing a post graduation is costly affair, and
Hmm.
I was not at that stage. I was not like my family is not very well to do. We are a
Hmm.
basic middle class family, so an average fee for a post graduation will be somewhere between 4 lakhs to 7 lakh per year, and that
Hmm.
too for 3 years, and then my stay, then my food, and then my thesis, everything. So that compounds to be a lot of thing, and I didn't want to get in debt.
Hmm.
at that time. Educational loans are available, yes, but
Hmm.
I didn't want to go in that route.
Hmm.
Now that was my personal choice. If somebody wants to go for a PG, then they'll have to like look in that aspect also. Now
Hmm.
my thing was ki my friends are going for PG, oh that's fine.
Hmm.
But if I start practicing now, in
Hmm.
3 years of times, when they are out, I'll be at their level because I'll invest in some other courses, maybe
Hmm.
not in their particular field, because but as a general. Okay.
Hmm.
Now, so that was my thing. So once I
Hmm.
started, I like sab kuch kar liya. Now there was a point of time when um, like I said ki haan nahi, now I have to start my clinic. Okay.
Hmm.
And I started my clinic. At that time, my friends were just passing out from postgraduates. Now, once you
Hmm.
are done with your post-graduation, you're already in debt. Ya fir your family
Hmm.
has invested in you. You have that
Hmm.
onus because at that point of time, you have that much maturity ki nahi, I don't want to take money from my family and everything,
Hmm.
because you have that, like, I hope you have that kind of thing.
Yeah.
But still you have that personal sense now.
Hmm.
Young generation ko hota nahi hai, but as we were
Hmm.
younger wo hota nahi hai, but as you grow older you have that sense. So
Responsibility. Yeah.
responsibility and everything. But so now my friends were saying like, "Nee, I have to invest now." They have to invest again in the clinic and wait for that 3 years. Now,
Hmm.
once you're out, you're doing your BDS, you already like established your clientele base, and then
Hmm.
you're moving forward because by the time they were doing the PG, you have your client base. That is the
Hmm.
benefit of doing a BDS.
Hmm.
Okay. Now the second part, if you're doing a PG,
Hmm.
now your advantage is that you are a super specialist. Okay, you are a specialized in that
Hmm.
particular field. So if you have a lot of network in your area where you are going to practice, you right away get a lot of clientele just through your networks, because
Okay.
you go and approach to a doctor like,
Hmm.
I'm this XYZ specialist, and I go
Hmm.
to them. Now you have an access of their clientele base.
Hmm.
So that is the advantage of doing a postgraduate.
Hmm.
I'm talking purely in that sense. I'm not talking about I love this subject, so I'm doing that subject. I'm not talking on that
Hmm.
perspective. I'm
Hmm.
talking about the business sense,
Hmm. Yeah. Like where there is demand.
where there is demand. A lot
Hmm.
of postgraduates are also doing general dentistry rather doing a specialized thing.
Hmm.
So they also are doing a general dentistry apart from doing just the specialized thing. Now
Hmm.
that's their own personal
Hmm.
take on it. Because you'll ultimately you'll have to sit in, if you're opening up your own clinic, you'll have to sit and you'll have to do all the
Hmm.
procedures which are required, not just your specialized procedure.
Hmm.
Of course you'll master that, you will be master in that, but initial stage mein aapko wo bhi karna hai if you're putting in your own
Hmm.
clinic.
Right. Like I see in general, I've seen few videos where they say there's a trend going on, like compared to like in the last 100 years, where people who have specialization in any domain used to be valued more. But nowadays, it's more about people who can generalize also very good. It may be like a CEO who knows a little bit of everything and still good at making decisions like that. So, what do you think will be for dental, like currently and going future in future? What will be the demand?
The demand I cannot say much because
Hmm.
the last decade has changed a lot. So I've
Hmm.
been practicing since 1 decade now. वो
Hmm.
decade में ना the patient's perception has changed a lot.
Hmm.
पहले कैसा रहता था, anybody like the कि if you're doing something, I want it easy. Like if you say, if the patient says, like I say to the patient, I'm sorry, if I say to the patient saying that कि नहीं, this is what is it is going to cost you and this much time it is going to cost you. Like
Hmm.
emphasis on time कि हाँ
Hmm.
बाबा इतने 4 बार आपको आना ही है.
Hmm.
The patient used to come and they used to not like argue with you कि इतना time क्यों लगेगा. But now it's like this, like quick. I need it now. I need it now. I need it now. So now
Hmm.
when you need it now.
Hmm.
Now I will of course ask my specialized person to do it now and then go
Hmm.
ahead. In that way,
Hmm.
it is changing. But
Hmm.
that I need it now has a lot of potential also again, but there
Hmm.
is a lot of drawbacks because nobody is ready to accept, like
Hmm.
the general people, that dentistry is not like कि दवाई ले लिया खत्म हो गया. It takes, your body takes time to heal. The
Hmm.
amount of time to get a decay is years together, and you
Hmm.
expect it to get over within a day or two.
Hmm.
So that is the biggest thing, that patient's perspective is like changed.
Hmm.
And to get that demand, like to get that time, and then the dentist, what they are doing is they are submitting.
Hmm.
Okay,
Hmm.
they're submitting towards it, but that should
Hmm.
not happen, but that is happening in real world.
Right. Right.
Everybody wants to do a quick buck.
Hmm.
So that has
Yeah.
changed, first of all.
Hmm.
Uh, and that is what I have seen. And the second of
Hmm.
all, what I have seen is uh, a lot of dentists are coming up. Okay, I'm even though I'm saying that many dentists are like we have that parity between number of patients and number of doctors, uh,
Hmm.
but uh, there's a huge chunk which is in metro city, and there is nothing in
Okay.
rural area. So
Hmm.
now, because of that clutter,
Hmm.
जो नया बंदा आया है जस्ट मेरे बाजू में, he'll
Hmm.
charge like 20% less as compared to me.
Hmm.
The patient will also think कि नहीं, I have to go there and then मैं उधर जाएगा और मैं कर लेगा ना. This is the plain
Hmm.
statement of patients also. यार वो
Hmm.
तो उतना ही चार्ज करता है, आप इतना क्यों चार्ज कर रहे हो, I'll not come to you. And with
Hmm.
that fear, what I'll do is I'll reduce my charges also.
Hmm.
I reduce my profit margin, and then because I want to get a very good profit margin, I'll buy a very cheap materials to use with.
Hmm.
This is also one fact. Now people
Hmm.
people are going to like take a sword or take a knife and like put me in a corner, but this is the fact. Don't
Ah.
reduce your charges, because like
Hmm.
take that money and invest in a good instrument, good invest in a good material, and that will benefit your patient.
Hmm.
बिकॉज आई नेवर कॉम्प्रोमाइज विद दोज थिंग्स. अगर उतना
Hmm.
टाइम लगने वाला है तो टाइम लगने वाला है, इतना पैसा लगने वाला है तो इतना पैसा लगने वाला है. सो
Hmm.
दैट इज द थिंग दैट इज गोइंग टू हैपन.
Hmm.
So now, in general, because of that fear of losing a patient and
Hmm.
losing everything, so new, especially the newer generation, newer dentists which are coming out, which don't have that kind of knowledge, and they want to
Hmm.
like immediately go into the market and start your dental, like put a
Hmm.
clinic and everything. This is what is happening
Hmm.
now. You'll have to say now, if I have to go with my journey, so
Hmm.
I I I had a thing with dental photo, like photography. I used to like it, so I pursued with dental photography. Now that is my USP. Now, what is your
Hmm.
USP? You'll have to
Hmm.
define it. So if you don't
Hmm.
have a USP, why the patient should come to you? What do you have? Because
Hmm.
if you're talking in general, everybody is doing everything, but what do
Hmm.
you have? For example,
Hmm.
like specialty. So if you're doing a specialty, that is your specialty. But if you are a BDS, you should also have a specialty.
Hmm.
It should
Yeah.
not bind you ki saying ki like nahi, just you are just a BDS and you cannot do it. And there are n
Hmm.
number of things to do in dentistry. There are a lot
Hmm.
many things, because
Hmm.
as a whole, dentistry looks like this much, but
Hmm.
it's like an iceberg. You don't know
Hmm.
the beneath of it.
Hmm.
अंदर कितना है.
Right, right. So yeah, I think in general it's good to adhere to the patient's demand, but if at some situations like there's a quality compromise, we should maybe dentists should educate them like see like it's all about value for money, right? So
Yeah,
it's
yeah,
not like they're saving 200 rupees, but the value they're diminishing is about 2,000. Maybe after a few days or months, they have to visit back because of poor quality.
yeah, yeah. And this
Hmm.
especially is happening with new. So as we had a discussion before, like this
Hmm.
is towards the new dentist which we are like aiming for. So
Hmm.
my like my take on this is ki don't reduce your value in
Hmm.
both ways, monetary and your dignity.
Hmm.
Don't do it, because
Hmm.
द- कुछ 6 महीने बाद दूसरा कोई आएगा और गिरा देगा, तो व्हाट विल बी
Hmm.
योर प्रॉफिट मार्जिन एंड व्हाट विल बी योर डिग्निटी के हाउ अबाउट क्या करोगे यू व्हाट.
Right.
डेंटिस्ट आर बेसिकली लेबरर्स, दे आर नथिंग
Hmm.
एल्स, दे आर जस्ट अ लेबरर. डेली वेज पे हम लोग काम करते हैं.
Hmm.
So if you go to clinic, you'll earn. It's the same
Hmm.
thing. That's the fear that is holding on a lot of dentists.
Right.
कि- so that is the reason I should not increase my uh, like
Hmm.
money के वजह से मेरे पास patient चले
Hmm.
जाएंगे. But
Hmm.
because as a medical profession, we don't know anything about business.
Hmm.
Seriously, we don't know anything about finance. We don't know anything about business. So
Right.
that is the advice I'll give you. Go
Yeah.
and learn about business, and go and
Hmm.
learn about finances.
Right. Right. So yeah, like building and maintaining a reputation will be more valuable instead of reducing the your own value and becoming detrimental to your reputation there.
Yeah.
So like considering like the path that you had took, like how feasible do you think everyone can pursue that, or like what other possible paths they can explore as of today?
I know a lot of dentists who have left dentistry and doing something else. So they are doing MNC jobs, and they are doing, they're pursuing their hobby, like dancing career, and people are teaching dancing. People are doing, what do you call that, wedding planners and all. So I've seen dentists who do that also, dentist people. So um, the ones who are saying, like pursuing to say that I don't want to do dentistry and I want to do something else, of course, it's your own choice. You can do it. But if you want to be in like dentistry and go forward, there are a lot many things to do, lot many things to do, because uh, the time frame which I've seen, like patients perception change from quality to time value. So now people value time more. It is going to increase now if you have that speciality to decrease the time between the patient's visit and everything. So that will be your USP. Now uh, my path is very easy, I'll tell you. So doing a dental photography and learning about dental photography and pursuing that is very easy. So if you put in like 6 months or so, you'll also be in at my level. It's not that difficult. But the thing is, you'll have to practice it a lot. So it's up to you now. Now, there is an upcoming field known as laser dentistry, which nobody knows actually. So if you take 100 dentists, maybe 20 of them know. 100 people will know there's something known as laser dentistry, but 20 will know what exactly it is and what it is going to. Now that is going to pick up. So that's one of the options. So
Right.
like that, you'll have to search it because
Right.
people will not teach you. Now, the other day I was teaching about on this dental photography itself to the interns. So I had a lecture for the interns. So now one of the interns questioned me, like, you had done your laser dentistry. Explain us what it is about, because he was curious. So now, so if he is curious, I can see him pursuing some others also. Like maybe he'll do lasers or maybe he'll do something else, but he'll learn much more. But now it's up to you, what you want to do.
Right. So being from a tech background, I can, say for sure, like technology, the trends keep changing so fast.
Yeah,
We
yeah,
have to be up to date with what's happening. And it's also penetrating dental industry now, right? Like all this
yeah, yeah,
photography, laser, these are all tech penetrated. So like, yeah, they have to keep a watch out on like what is the next trending thing and what's
yeah,
likely to, what is real hype? Or is it like a just myth kind of a hype, or it's a real potential?
yeah,
So they have
yeah,
to ensure that.
yeah, yeah, yeah. So, as Shashank, you said, ki, if there is a real hype or not, there are a lot many things which are coming, which are not that advantageous to us, but there are a lot many texts which is coming inside, like which is blowing away our minds also, and our seniors, like we from whom I had learned, their minds are like blown away. अरे हम लोग तो ये हाथ से कर रहे हैं. Now there's a machine to it. It saves a lot of time because it's also task, like very tiring to our body. It's very tasking. We'll have to like hunchback. Most of the times people hunchback. There's not a proper ergonomics because they do teach how to like
Yeah.
take care of your body, but people are people. They don't follow proper guidelines. But now to like do like even for a posture, how to prepare a posture, there are seats which are like, there are chairs which are available to get your
Okay.
posture in line. We used to do root canals by hand, like a decade ago, like by literally by hand. So there was a file and we used to do it. Now there are machines which are available now. So if you're doing by hand, which takes 45 minutes, this will take like 10 minutes. That's it. And your procedure is done. The patient can go home. The time frame reduces. Now, if you set that time value, that you'll have to perform.
Right.
So that way, dentistry is changing in an exponential way.
Nice. So, can you discuss about some hindrances that usually people can expect to face in their career journey?
Uh, it's mostly monetary. Mostly monetary, and your thinking of the external world. So if you have anybody who is a dentist, no, a known dentist to you, let's say in your family, your mother, father, your brother, somebody, they are the perfect guide for you because they know in and out about the industry, what is going on and how it's not. But if you have I had no idea. I don't have any extended family who isn't. I am the only dentist,
Okay.
apart from my wife, but I was the only dentist in my
Uh,
family. So
mm,
I had absolutely no idea about how to go about what exactly it costs and everything. So it's
mm,
mostly involved with money. It's
mm,
it's a costly affair. Okay.
mm,
So now an average private college will charge you somewhere between 2 to 4 lakhs for a BDS
mm,
degree per annum.
mm,
Okay. Once you're out, and then to set up a clinic, you'll need at least minimum very basic setup. Without the shop, of course, it will be a
mm,
rented shop. So very basic minimum setup is somewhere between 5 lakhs.
mhm,
So you need that much amount of capital upfront.
mm,
Okay. Then you'll have to think about where you want to put. That is also an important question which we face, is where do you want your clinic to set up? Do you want
mm,
it in a very crowded area or an external area? So if you
mm,
are in a crowded area, footfall is more. If you are like in a sideways, your footfall is less. But if
mm,
you have that network, so one
mm,
thing is you should have a network. That's the biggest hindrance. And the second thing is monitoring. For me, at
mm,
least, monitoring was at one point of time. So it
mm,
was there. So when I wanted to uh, put down my clinic, so
mm,
these two are not taught in dentistry, like in
mhm,
college, in dental college level, or nobody will uh, guide you unless and until you pester them. So go
mm.
and pester them कि जाओ
Yeah.
पूछो, अरे कितना हुआ कितना नहीं हुआ, कि
Right.
क्या लगता है कितना कॉस्ट आता है. सो देर आर
Mm,
लाइक शोज विच हैपेंस, वर्ल्ड डेंटल शो WDS करके है, इंडिया में होता है. सो यू गो
mm,
विजिट देम कि चेयर कितने का आता है, वेदर यू वांट इट और नॉट. अगेन, सो
mm,
हाइप एंड रियलिटी, एज वी वर टॉकिंग अबाउट अर्लियर. सो देर आर
mm,
डेंटल chairs which are available at 12 lakhs on just the
mm,
chair. So
mm,
do you actually need it? So
mm,
you get a chair about for 1.5 lakh also, which will
mm,
like serve your purpose. So do you need a
mm,
chair for 12 lakhs? So
mm,
it's now it's up to you. So if you are serving a celebrity, of course you need that chair of 12 lakhs because it should look
mm,
that way. But
mm,
if you're like serving people in rural India, do you need
mm,
that 12 lakh chair? No.
mm,
So go visit that. So that is the hindrance. We don't know exactly how much it costs. As I
mm.
earlier said, business side, we are not trained at all. A medical
Right.
person, not trained at financial or business person. So we'll have to think
Mm,
about that. कि आपको ROI कितना होने वाला है, कितने साल का होने वाला है. We don't
mm.
know.
Right.
So that's
Yeah,
the
so like I think being good in social networking will help them both find their clients and also learn about these things like the business
yes,
side, the finance side, and what are these
yeah,
problems that they can face. Yeah.
yeah. And the first thing I advise, ki, if you pass out and you want to straight away put up your clinic, don't do
Mm,
it.
mm,
Go and learn from somebody who is a
mm,
very good, like the ones you see as a teacher for you.
mm, mm,
Go and learn from them कि आपने क्या किया था, what hindrance you had, whether it may be your senior, immediate senior, or
mm,
a very known person or very known, well known doctor in your area.
mm,
Go learn it for free. Okay.
mm. Yeah,
उनको पैसा मत मांगो स्टार्टिंग में. Nobody is going
exactly.
to pay you like upfront.
Mm,
Prove yourself, they will pay you if you want to continue. Otherwise, tell them I just want to observe. Nobody will say no
mm,
to an observation.
mm,
No dentist will say no to observation. उनको क्या,
mm,
हाँ आ जाओ, because you'll stand, you'll just see. And observation ऐसे नहीं है कि जाके खड़े रह के सिर्फ ऊपर देखना है.
mm,
Learn their book management, learn their patient management, learn how they treat their um,
mm,
clerical staff, learn how
mm,
they increase love, like their
mm.
journey in their life कि कैसा उन्होंने cleaning डाला. So observe that also, ask them,
And
pester
maybe they
them.
can be more proactive and also assist them now and then while they are
Yeah,
observing anyway. And so maybe that will
they-
help them to incline them
yeah,
to,
yeah,
actually hire them as an intern
yeah.
or a full time eventually.
Yeah, so people
Mm,
do teach. Okay, so
mm,
whenever somebody, so when I was working with a guy, so he had 5 dental chair with him. So
mm,
I started with a very like basic ekdam niche. I was the one who was observing others. So I
mm,
did observation for a month, and then he
mm,
started giving me a patient.
mm,
Then years down the line, I was the one who was teaching 5 doctors under me.
mm,
So it's that kind of thing. So first learn and then teach
mm,
and teach others. So anyone who comes to me and say, "Kine, I want to learn this," I'm open for it. I share all the things. I don't.
mm,
Um, maybe not everyone will share, but if you
Mm.
pester them enough,
Mm.
they
Yeah,
will.
yeah, yeah. Like there's a sweet spot between pestering and poking them, so that they should
Yeah,
not get annoyed also, but they should
yeah.
also feel like you're interested seriously.
Yeah,
Yeah.
yeah. So if you show your interest, they will teach you the things which are not taught in, first of all, in your college, and second
Mm.
of all, they will let you assist you in the
Mm.
patient, and then you get a very good bird's eye view. Okay, how
Mm.
it is done, how the things are done.
Right, right. So yeah, I think it's really a good advantage if people can actually go out and get networking. They'll have definitely good advantage.
Even a
Mm.
BDS person, I have seen
Mm.
like earn lakhs and lakhs of rupees in a rural area. So most of the times, what people say कि वहाँ पे जाके practice नहीं करना है. That's a personal choice. But if you go and practice in rural India,
Mm.
there's something known as mass practice and there's something known as class practice. Okay, that's the term that
Okay.
we use.
Uh-huh.
So mass practice is basically doing it in a cheaper rate, but
Mm.
attracting a lot of people, treating
Quantity.
a lot of
Yeah.
people. Yeah, फिर आप 10
Mm.
लोगों को रखते हो अपने नीचे and then you like do a lot of them. Now class
Mm.
practice is performing only like few patients per day but charging
Mm.
them a very high amount.
Mm.
So now you decide what you want to do.
So when should what kind of a person or what kind of situation should they think of in their career journey, when they should think of going foreign versus being here itself?
So foreign, if you want to go outside India, make sure that like there are some countries which accept as a BDS degree as their like a valid degree, but as I told earlier, ki, like if you go for a very developed country, and there our degree like is not valid. So
Hmm.
a BDS degree is not valid. You'll have to do the same degree again there. But of course,
Hmm.
they will give you a certain leeway. They will like
Hmm.
say कि हाँ पहला एक डेढ़ साल का will exclude that, and then you start
Hmm.
with directly from the second year, and you can
Hmm.
finish earlier also, giving exam
Hmm.
like regularly, like फटाफट exam देके you can finish it off. But
Hmm.
it also takes around 2 to 3 years depending where you are going and
Hmm.
like which country you are going. So
Hmm.
once you do that, then you are at a PDS level there.
Hmm.
Okay, then you are allowed to practice, but some
Hmm.
countries they allow you to practice right away but not every patient. So
Hmm.
you're not allowed to do a root canal. You'll be allowed to do a normal scaling, and then you give an exam, and then you are allowed to do like
Hmm.
certain period of time, 2 years, 3 years, you do exactly this much, and then you prove yourself, and then you. So that is the thing that a dentist has to think about.
Hmm.
Okay, whether it, now it's a personal choice where you want to go, and again monetary
Hmm.
thing plays a lot of role, because
Right.
if you're going there and picking up an education loan,
Hmm.
वहाँ पे education loan like is very costly.
Hmm.
If you're going outside, make sure you're practicing there rather than coming back. But if you're going
Okay.
for a very short course, like three
Hmm.
months, 2 months, 1 month, 1 week, of
Hmm.
course you can go back, learn, and come back. So that's a short course. That's a certificate course. That's valid
Okay.
everywhere. So that's
Okay.
fine. So you can come back and
Hmm.
again practice and showing that I have learned from that and practicing
Hmm.
a certain aspect of it. But
Hmm.
if you want to do a DDS and dedicatedly go outside and dedicatedly do that, just go and
Hmm.
stay there. Don't come back.
Right.
Don't come back to practice here, because the amount of time, value, and money that you spend there for
Hmm.
recovering in India is not possible at this, at least like while recording this stage of
Hmm.
India is not feasible for that, because to get
Hmm.
your ROI in India is very difficult.
Hmm.
One thing that you'll have to also think. So one more point I'd
Hmm.
like to add is if you are opening a clinic. So as I said, कि
Hmm.
there's a roughly a 5 lakh का budget आपको लेके चलना पड़ता है. This is
Hmm.
apart from saying that कि first 6 months
Hmm.
you should have that much of cash with you. That
Hmm.
let's say your rent is 15,000. So
Hmm.
initial 6 months, like 6 into 15,
Hmm.
that much amount plus your assistant's kharcha,
Hmm.
like whatever you
Hmm.
want to pay her, 10,000, 15,000, whatever XYZ, that should
Hmm.
be in your pocket to start out,
Hmm.
right? So if you expect कि आज मैंने clinic खोला और कल से मेरे पास patient आएगा, that is not never going to happen.
Hmm.
So
Yeah.
unless and until you have an USP.
Right. Right. And also, especially, they should be ready for situations like COVID. Like it may not be just
Yeah.
6 months to expect a return. It might take even longer.
Yeah. I have seen my friends like going in debt only because of COVID.
So I think it's more about a personal choice. Like if they actually want to go abroad, and other than that, like monetary aspect, they have to ensure. But yeah, the respect and the kind of opportunity they
Yeah.
have is outside is
So
good.
now opportunity, if you go only by monetary value, वहां पे a dentist earns a lot folds time lot
Mm.
than in India. You'll be able to
Mm.
recover it very fast, very fast.
Mm.
But
Mm.
uh, again, the point is there. Even though you will earn, you'll have to
Mm.
again once you pass out, you'll have to. You cannot just put in a clinic like as you
Mm.
can do it in India. कि आज जाके मैंने 5 लाख रुपए दे दिया and you like you
Mm.
set up a clinic. There,
Mm.
setting up a clinic will cost you around $1 million.
Okay.
So what,
Mm.
where from where you will bring it? Because
Mm.
insurance and all pays you a lot in outside India. So because there is
Mm.
insurance for oral like oral things like
Mm.
braces and everything, they earn a
Mm.
lot. So number one profession in US is like earning wise is
Mm.
dentistry.
Oh,
But
okay. Mm.
so but to put in that much, they'll have
Mm.
to they are in debt of millions of dollars already before even
Mm.
starting out.
Mm.
So there's both ways again. So
Got it.
if you are here, you'll have to look for that also.
Okay. Okay. So, anything else that you want to cover, like some things which you wish you had known earlier, some mythbusters or hypes or anything?
Wish I had knew earlier was dentistry is a very complex field.
Hmm.
Uh, it's not well respected in India, first of all, as it
Hmm.
should be, but it's a beautiful profession regarding if you know your things properly, you
Hmm.
can diagnose a patient of a diabetes and a blood pressure just by looking at the oral cavity, and
Hmm.
that is where you impress your patients.
Hmm.
So
Hmm.
that's the thing I wish I did earlier. The second is again the monetary value.
Hmm.
Okay, nobody talks about it. There's a
Hmm.
lot of capital involved in dentistry. So
Hmm.
many of times I've seen like people who say कि नहीं मैंने because I didn't get an MBBS, I have taken a BDS thing.
Hmm.
It's not the same.
Yeah.
It's not the same. An MBBS guy can just go and rent a shop and put one table and that's done. Okay.
Hmm.
But यहाँ पे the initial capital is a lot more and get to like getting a setting up because there are no subsidies available. There's
Hmm.
nothing available. If you think कि dentist को ये बहुत कमाते हैं, दूर से ऐसा दिखता है बहुत कमाते हैं, but we
Hmm.
also spend a lot.
Hmm.
Okay, to put a crown example, so around 70 to 80% of the crown cost is like we put
Hmm.
in initially, even before you pay us,
Hmm. Hmm. Hmm.
and then we put. So we are earning hardly somewhere between 10 like 20%.
Yeah.
So उनको लगता है कि I'm paying so many things like thousands of rupees, so he must be earning a lot. So it's not that. पहले मुझे भी
Right.
लगता था कि अरे वो तो इतना कमा रहा है, he charges so
Uh,
much and he must be earning so much thing. Like
right.
it's not. Even though there are a lot many. So where I practice, we have 40 dentists here.
Hmm. Hmm.
Everybody is earning.
Hmm.
Somebody like some of them are earning a lot because dentistry is a relatively new for Indians also, like
Hmm.
modern dentistry I'm talking about, not the older dentistry. Now
Hmm.
modern dentistry, who were the first dentists, that was their USP. They were the
Hmm.
first in their town. Now they
Hmm.
earn like I know people who own Mercedes, I know people who own BMW, they are
Hmm.
dentists.
Hmm.
Okay, BDS by the way, not even
Hmm.
MDS. So,
Hmm.
but their USP was they were the first. You are
Hmm.
not. So you'll have to
Hmm.
create your own USP. So that is the thing I
Right.
didn't knew first. Yeah, वो सब
Hmm.
लोग लेते तो like we can also do it, but it's not the same thing.
Right. Right. So, any other general life advice or lessons that you want to share, not only like dental aspirants to, or any student in general?
Anything general, like life advice is basically don't get disheartened if you don't get things right away. They will come to you. They will definitely
Hmm.
come to you if you work towards it.
Hmm.
You might face ki like ki nahi, this is not going in my way in my certain path. So
Hmm.
what people tend to do is ki nahi, yahi hai, this is what I
Hmm.
want to do and this is what I stick. But what is
Hmm.
your safety net?
Hmm.
You should always have your safety net and then
Hmm.
head towards it. So like
Hmm.
as we met in video editing cohort,
Hmm.
so if I wanted to push inside much more, I have a safety net back now.
Hmm.
So I was very much interested in videography and everything since like
Yeah.
last decade, as I
Hmm.
told you already.
Hmm.
Okay. But now I'm practicing because now I am in that state that I can pursue my passion,
Hmm.
but I have a safety net too. because
Mm.
I have responsibilities, and you, as a youngsters, you don't know, you are a carefree kind of thing. But as you
Mm.
grow older, you come to know, okay, like it's not, I'm not putting that older advice कि नहीं तुमको समझेगा जब तुम बड़े होंगे, but that's true in a sense that even I didn't knew it, because that's the age
Mm.
factor. In the
Mm.
teens, we are not very much like thinking in that way. We are, what we are
Mm.
thinking is like now, अभी का सोच रहे, आगे का
Mm.
पता नहीं.
Mm.
But that is what the thing is. कि even if you don't get it right away,
Mm.
don't worry, it'll come to you.
Right, right. So I think it's important to plan ahead also, and also consider all different paths and safety nets,
Yeah,
etc. And they should also not rely too much on it coming to you. They should also be like a go-getter mentality.
yeah, yeah.
Then definitely both side it will help
Yeah,
you.
you should be proactive.
So yeah, I think that's all we had planned for this session.
On the top of my mind now, the only thing that I uh, remember is a dentist is not valued in
Hmm.
our society.
Hmm.
Okay, the phrase that dentist doctor होते हैं क्या, so
Hmm.
that's very common. Okay, that's
Hmm.
very common. And as a young dentist, so if I just passed out, that will hurt me more.
Hmm.
But now it's like कि फर्क नहीं पड़ता है.
Ah.
ठीक है, whatever you think, I don't matter. But at that time, it's like कि मैंने इतना 4 साल मेहनत किया है. I have done so
Ah.
much. I have learned, because uh, what MBBS and dentistry has common is the first 2 years we learn the same thing that they learn, and then we go
Okay.
into specialization. So
Hmm.
that people don't know.
Hmm.
Okay? So that's not even their fault. It's just the stereotype that has stuck. But that's
Hmm.
fine. Now if somebody tells me like क्या ऐसा ऐसा है, everybody like कि यार कुछ नहीं
Hmm.
होता है, डेंटिस्ट में कुछ नहीं रखा है.
Hmm.
There is a lot that is there, but there is a
Hmm.
lot that is also not there.
Hmm.
Okay, a lot that is there is you still have that patient one-on-one communication, you still have that chance of changing somebody's life, but a lot
Hmm.
that is not there is the opportunities that what government is providing or what society is providing.
Hmm.
That's not there. Maybe in future it will be there. So there's
Hmm.
upcoming, like, we don't have an insurance, dental insurance as of now, but people are
Hmm.
working really really hard to get that dental insurance. So once the
Hmm.
dental insurance lands,
Hmm.
everyone will be benefited, even the patients and the doctors both,
Hmm.
because insurance will cover it, and people will start getting their root canals, getting their fillings, getting their orthos.
So I think that's all we had planned for the session. It was really great interacting with you, Avinash. Thank you for being with us.
Same here, Shashank.
Thank you.
Thank you.